Hi, everyone, and welcome to another episode of Psychology for Growth. And in this video series, where I interview a lot of people in the field of mental health. And today, I'm really excited to talk with a colleague of mine. We met many years ago. She's from California. She's a psychologist. She's also the director of a counseling program in the state of California. And we are going to talk about AI and technology. And AI technology in the field of psychology. And that's on today's episode of Psychology for Growth.
Thank you for
Milena,
having me.
welcome. Yes. Yeah, it's so good to see you again. It's been a while. And that's one of the things I'm enjoying about this process of recording interviews is I get to see some friends that I haven't seen in a while and
Yeah.
get to learn what they're doing and hear some of their expertise and their knowledge in so many different areas. So yeah, when I reached out to you, we were talking about artificial intelligence, and I know you've been pretty active in the field in terms of like attending workshops and conferences and speaking to people in the area. What's one thing that's standing out for you from the courses and workshops you've attended?
What stands out to me most is how our field really hasn't shifted or integrated technology, or there haven't been any kind of brand new, exciting developments, I think,
Mm,
in like the last 100 years, right? We've been
right.
practicing pretty much the same way Freud did. We see clients once a week for an hour, we do this talk therapy. COVID created a big shift where many clinicians felt they could never do therapy that wasn't in person, right? We all
Right.
thought that wasn't possible, it wouldn't be as good. And yet, most of us discovered we could provide psychotherapy online, over Zoom, over phone, and our clients continued to feel connected and we continued to make progress. So that was a big, surprising shift. And now, what I've been so excited about learning about AI and all the ways it works in our general life and in other fields to try to think about how it can support the development of our field in all these different
Mm,
domains, right? How can it make clinicians' lives easier, better? How can it improve the experience for clients? How can
mm,
they get better more quickly? How can we minimize the administrative burden on clinicians? How can we improve the teaching of clinical skills? How can we improve research with all
mm,
of the power that AI has to offer? I see it as this magic tool that has so much potential to really shift the future of our field. So I,
mm.
as somebody in the field a long time and not seeing a lot of dramatic change in how we do therapy, see so much emerging, and I want to be a part of that exploration and transition or development. What I see is a lot of tech companies and folks who are working in AI and engineers who have a lot of ideas and they're building products, and I want to be the clinician on that team that says, here's what I know about the field, and here's what I know about training mental health providers and the pain points that they experience, right? I love this intersection of the tech experts and the clinical experts
Mm.
and the researchers working together. I think that's the juicy sweet spot that I want to play in.
Oh, that's excellent. What's coming through to me is just your excitement and enthusiasm regarding this field, and it is does sound revolutionary. And I agree with
Yes.
you; it will be
Yes.
revolutionary.
Good word.
So hearing your excitement is so refreshing because for so long, when I hear about AI, in society, there's almost a bit of anxiety, a bit of fear. In
Yes.
terms of like, oh, it's going to, on one end, it's going to take our jobs away and then lead to more unemployment, and then you hear about, the use of artificial intelligence in terms of like, in the military and how dictators or perhaps people with bad intentions can
Yeah.
use it, in a harmful way. So that's one of the
Yes.
things I've been hearing about. And I think a lot of times in the media, we tend to read those kinds of stories
Right.
and it generates so much fear
Yes.
and anxiety. So to hear about your excitement and a whole new way of looking at it is really refreshing. I appreciate that.
Thank you. I think that's part of what makes me unique is that I agree. There are a lot of clinicians and most of my colleagues and educators who I feel are rightfully, legitimately
Mm,
nervous and
hmm
concerned. And how will
hmm
this change how they teach, how they provide therapy? And there is very good reason to explore all of the ethical dilemmas, right? They're
mm,
very important and all of the risks. We can easily think of the dystopian future, but I do
hmm
think we need to balance that with the possibility, right? We need to be clearly thinking about exploring both the risks and the benefits. I happen to be pretty excited about the benefits, but I keep my eye on the risks. I'm
Sure.
definitely paying attention there, but trying to not have it overwhelm my enthusiasm.
Sure. So
Yeah.
let's get into that in terms of how you see it being applied in the context of like talk therapy. So I know for myself, for example, that on a very basic level, I'm using AI, let's say when I'm writing a sentence perhaps,
Yes.
and
Yes.
there is like not only the autocorrect, which can be so frustrating at times, but it actually will like start to identify the next few words, based
Yeah.
on my writing style, based on what I'm
Right.
trying to say. It just
Yeah.
detects it automatically. So I could see how in the administrative sense, in terms of
Yes.
note taking, I could see
Yes.
how it can be advantage, but
Right.
I'm curious about how it could be used in the context of perhaps making us better therapists. I got a client who comes in, they're dealing with an issue. How could I use, or how do you see AI being used in that context?
This is hundreds of
Exciting.
hours of conversation, just this one little question.
I can
So,
imagine.
here's an interesting tidbit to start. I speak with a lot of colleagues in the field, folks that are supervising younger clinicians early
Right.
to the field. They are already starting to use ChatGPT during their session. So they may be seeing
Oh.
clients online. They've got ChatGPT pulled up. They're not sure how to proceed. They have a question about what to do next. Now, there's a concern about multitasking and divided attention, but they're getting cues or prompts to integrate into their session as they're working. So this is just
Oh.
in the wild how younger people are already playing with the technology. What I was happy to hear from the director of this clinic was that they were concerned, they were curious, they were monitoring what this was about, how this was going to change therapy outcomes, client outcomes. What's great is this is a clinic that is collecting data about how clients are doing each session, how's the alliance, symptom inventory, are they improving? So
Hmm.
they're not seeing it negatively impacting client outcomes.
Hmm.
So that's interesting. But now
Hmm.
imagine the very, very advanced form of that, where you really have products that are created to support clinicians, where there are prompts on the side to say, oops, we've heard
Oh.
this emotion. There seems to be concern about depression. Can you, here are some questions to start evaluating for this diagnosis or for, a crisis assessment, right? There are things that we miss as clinicians. What would it be like to have prompts if we have
Hmm.
ambient AI listening to our sessions and it is picking up patterns, picking up emotions, picking up responses from the client, words, phrases that are patterned to certain behaviors, certain diagnoses. It can cue us to maybe redirect, right? And have a more productive therapy session or to more accurately diagnose a client. What can we
Hmm.
learn? I think of AI, the potential for it, right, as this additional thought partner. It's augmenting our clinical skills. What is it picking up that we may not pick up, right? Because it's designed to pick up so many patterns that we can't see. Like there are
Right.
tools right now that pick up all of the different emotional components of a session, second by second. Oh, the client is feeling this percentage of determination and this percentage of curiosity and this percentage of happiness, right? And how does that shift throughout the session? And how does it shift based on the therapist's intervention? And
Mm.
then we can go into the psychotherapy process research around what combination of emotions and interactions between the therapist and client predict positive outcomes, right? There's so much data that we can collect and analyze and evaluate to see what's working compared to historically, how have we done psychotherapy process research? We've recorded a session, we've trained somebody in how to code that session for different variables. It takes hours and hours and hours to code a psychotherapy session. But AI, you give it the rubric, the instructions for how to score, and it can evaluate so much of what is happening in a session. So there are companies like, I think Listen is a really exciting company doing just this. They are in the background collecting information about a psychotherapy session and can provide an overview, a summary of the themes that are coming up in the session, but also the skills that the therapist is using with the client, right? What CBT skills, what core counseling skills, what motivational interviewing skills are used or not used in that session, at what level. So now we can also look at fidelity to a model and think about that for training purposes and that for research purposes. How closely is a clinician following a particular model? Are they integrating the best practice standards from CBT or DBT? That's pretty exciting to me.
Wow. Yeah, there is so much to unpack there.
Yes.
Yeah. There's so much. And I hadn't thought of it, the use of AI in the way you just described it. And honestly, I'm getting a bit excited too because
Head exploding,
yeah,
right?
totally, absolutely. And I guess there were a couple of things that came up for me as you were talking. One was this sort of, ethical piece of like, well, having this, device or perhaps having this technology sort of sit in and sort of collect our session, what happens with that data. There's that. So that's the one piece.
And that's to point out very, very good observation. But
Mm,
right, and kind of the risk of maybe using a product like ChatGPT that is not HIPAA compliant, and
right.
um, we want to use and be aware of the companies that have the highest levels of security, privacy, confidentiality, right? That are using the same standards that psychologists are used to using for the protection of patient data. So that's something as providers we all need to be thinking about. There's so many companies out there doing so much. They need to
Right.
have a very high level of security, and the good companies do.
Hmm.
Um, there is protection there, but that's
Yeah.
something we need to pay
Explore.
very serious attention to. Yeah.
Right. And I guess too, to an extent too, I mean, sometimes, it's um the content, it sounds like what matters. That's the data. But the identifying information, that's the only thing I guess that would put a client at risk, if there was a kind
Yeah.
of a breach. So if we could somehow even remove that and
Right.
just stick with like just the transcript without knowing the person's name and so forth, then we
Exactly.
probably
Yeah.
would be
They're
okay now
removing
that I think about it.
identifying patient information, and often how it's been described to me. And again, I'm not a tech person, but that the data is kind of moving through a filter and you're pulling out the summary information about it, but you're not keeping often the original transcripts, and certainly not
Right.
keeping any identifying information about the client. Yeah.
Right. The so I love that piece that you mentioned about, using it in the context of the therapy session. And I know I've used I've used the internet and a lot of some sometimes chat. I don't think I've ever used Chat GPT, but sometimes I'll use Google, right? It's because Google
Yeah,
actually now has their own platform or their own model, right? Called Gemini, I believe it.
right.
And
Yeah.
sometimes what I'll do is I will tell the client in session, I'm like, oh, that's a fantastic question. Let's
I
Google it
love it.
together.
Yes,
Yeah.
yes.
So it
AI in the
becomes a bit
wild.
more
Yes.
collaborative, right? It becomes more of a collaborative and they know what I'm doing if I'm looking
Yes.
at them. Yeah. And going back to the ethics piece, one of the things I was thinking about, and I've heard another psychologist talk about it, is that, when we're meeting someone, I think it is our duty to do the best job that we can, right? To
Exactly.
help
We
a
want
person.
to. Yes.
We want to, right? We want to help the
And we have an
client.
ethical responsibility.
We
Yes.
have an ethical responsibility, right? Like we want to, yeah, that's right, to help and to help make a difference in their lives. So, from another perspective, like if there's technology that
Yes.
can help with that, and yeah, why
Why would
not
we
use
not
it?
use it?
Yeah, yeah, like
Yeah.
you said, to augment, right? To
Yes.
improve.
Yeah, to
Yeah.
get more insights about what's happening in the therapy session. What are we missing? I have found it. I've been playing around with a number of
Yeah.
different apps. I've been amazed also at how well the technology can summarize a session and really pull out the
Yeah.
important themes. Like it is
Mm.
so concise and clear thinking, much better than my
Mhm.
psychotherapy
Yeah.
process or progress notes, right? I can go on for days and give specifics. And it's like, let's pull out the most important parts of this session. And I'm like, yeah, that's what we did. That was great.
Yeah,
And then
that's
what's interesting, there
great.
are other products on the market that I have found interesting as well to support clients between sessions, right? The traditional model is we
Oh,
see a client maybe once a week, every other week, and we know so much of progress happens outside of that psychotherapy hour. It's what's happening in the world, in the real world. Are they applying the learnings in the real world? So there is, for example, I was talking to the founder of an app called Happy,
mm,
HPY. And what their technology does is after a session, you can the AI will generate some action items based on the content of the
mm,
session, mostly based CBT, DBT action
mhm,
items. And so here are some, maybe 5 things to do in the week in between therapy sessions. And the therapist can look at the recommended items and modify them or personalize them or suggest these 3, and then the client gets to work on those items during the the time between
mm,
sessions, come back and talk about it. So it's keeping the client active and engaged in the work
mm,
of psychotherapy, right? It's making it easier to continue the momentum. There's
mm,
other apps that are looking at and tracking client symptoms and behaviors between therapy sessions to assess for patterns that might put them at risk for maybe a relapse or a mental health crisis, or maybe it's just collecting data about their behaviors that are linked to a greater sense of well-being. So
mm,
maybe the app is tracking sleep and exercise and time on social media and contact with friends, time outside of the house. And based on that very personal collection of data, just specific to you, can pull out some recommendations. Oh, when you get 8 hours of sleep, when you go to sleep before 10 p.m., when you are out of the house at least this many hours, or you touch base with this many friends, you report a much higher mood, right? So it
mm,
can create this very individualized health plan from
yeah,
all the data it's collecting about us in between therapy sessions. And clients can choose to share that data with the therapist and have the therapist track, how's my client doing during the week? What's going on in their life? What symptoms are emerging? What themes are emerging? What's helpful? What's not? So there's just this ability for the client and the therapist to have access to more information, more data to help personalize and streamline and make therapy more effective, right? We know that
Hmm.
the more people are engaged and in the work and practicing what they're working on during the session, the more quickly they progress.
Hmm. Hmm. Oh, that's excellent. Yeah. I was just for some of our viewers who don't know, so CBT, cognitive behavior therapy, where we're
Thank you.
looking at both thoughts and behaviors to help change feelings. DBT is dialectical behavior therapy, and that's correct me if I'm wrong because I don't do much DBT. I do some of it, but it is looking at changing specifically behaviors. There is
Yeah,
some thinking, right, where we challenge some
absolutely.
of our thoughts, biased
Yeah.
thoughts, but there is more of an emphasis on the behavioral approach to change.
Yeah.
Um, so sometimes in session, what I like about what you were just saying is I'm just thinking, sometimes in session, I'll often do a little diagram of CBT where, like in a triangle, right? Where I'm saying this is our thoughts, your behaviors or actions and emotions. And I tell clients, I say, look, when we are in this office here, we can totally work on your thoughts and your feelings. But
Hmm.
once you leave this office, once you leave that door,
Yeah.
it's all up to you to change the behavior.
Right.
And what I'm hearing from you is like AI would be excellent at that, such as identifying these patterns of behaviors that can either, help, improve a person's mental health or maybe even hinder it, make it worse.
And
So if you
imagine,
could use
right, if you're working with a client and the behavior is to talk to one person a day or to leave the house and do a 10-minute walk a day. So imagine setting up reminders using technology to support that. Maybe it's your voice. You've left a message that says, hey, it's 8 a.m. Have you gone for your walk yet? Or
mm,
check in on whether you did A, B, and C and let me know how it goes, right? You can also, there's different technology that is supporting clients with therapeutic chatbots between sessions, right? So they both have a live session with a psychotherapist, but then they're also interacting with a chatbot in between times, right? To
right.
say, because what's interesting, right? The research suggests that most people really want help at hours that psychotherapists don't normally work, right?
Hmm,
It's 2 a.m. when they can't sleep. It's 10 a.m. when they can't get out of bed. There
hmm,
are times when people want access, right? When they're most in crisis, most distressed, most struggling. It's hard to wait days or
mm-hmm,
weeks to see someone. So if you
mm-hmm,
can have some kind of supportive ally in the in between time, that could be really beneficial,
mm-hmm.
especially in the context of think about the demand for mental health services and our
Yeah,
inability to meet
yeah,
that demand currently.
so
We
true.
know wait lists can be months long sometimes. Can we provide someone with a tool that can help in the interim? How do we
Hmm.
augment the work of the human psychotherapist? How can we use technology and AI for good to support the work? We know it's hard. We know
Mm,
there aren't enough providers around. We also know it's very expensive for most people to
yeah.
pursue psychotherapy. Insurance may or may not cover it. There may still be copays, but access to a chatbot, that's usually far more economical and
Hmm,
accessible to people, or accessible to people in rural areas, or you can imagine all the contexts where people don't have access, or also where there's more stigma and shame about pursuing psychotherapy, right? It's
that's so
much
true.
easier to talk anonymously to someone, to talk to them, to chat with them now, you know pretty soon it probably already exists, right? The video, well, it does exist. There are, virtual avatars
Yeah,
of psychotherapists that can
that's
provide
right.
therapy. And we may not be
That's
able to
right.
tell the difference between the human and the avatar.
Right.
Um, and I'm curious your thoughts about
Yeah.
this. Like for those clinicians in private practice, what if you could make an avatar of yourself? What if you could, through your data about yourself, your book, your ways of working. We all work
Hmm.
a little bit differently, right? We're integrating different models. What if we could combine all of that and create an avatar for you that is accessible to your clients between sessions? Are there Esther
Yeah.
Perel was talking about that on one podcast I was listening to, where one of her clients, without asking about it, just made an avatar of her because she's somebody in the public domain that has so much information about her. It's easy to pull that information and create a chatbot, if you will. But
Yeah.
individual
Wow.
therapists are going to be able to do that soon too.
Yeah. Wow. That could be, again, that could be exciting and also a bit frightening and a bit
Brings
anxiety
up a lot of
provoking.
feelings, right?
It does. It does. And this might be a good segue, onto this sort of other side of it, which is we're talking about the clients, the use of AI to help improve the mental health of the
Yeah.
clients. Let's look at the therapist piece now, both in terms of therapist like development,
Yes.
therapists who are training to be psychologists and mental health
Yes.
professionals.
Yes.
Yeah. So, what
I
are
have
some of
lots
your
of
thoughts?
thoughts. So glad you
Yeah, yeah, I
asked.
want to hear them.
So, I've been training mental health clinicians for almost 20 years. I've run
Right.
a graduate school of psychology, trained master's level counselors and marriage and family therapists. And it's frustrating, it's
Mm,
discouraging, it's hard
yeah.
because, and I'm curious your experience as a student. And when I reflect on my own experience as a student, there was nobody that watched me do therapy. That all
Yeah.
happened behind closed doors. We didn't audio tape. We didn't videotape. We didn't have somebody in the room with us watching. How is typical supervision practiced? How is learning usually practiced? We go and we see a client, we practice our skills, we come back the next week and we talk to our supervisor about how we
Yeah.
think the session went. We're
Yeah.
trying to remember what happened. What did they say? What did I say? How do I
Yeah.
feel they responded? How am I feeling? That's so subjective. And if we apply
Hmm.
the psychology of learning, we know that doesn't work. We need objective
Yeah,
feedback
we
in the
do.
moment and to be able to correct small skills and practice them over and over and get that immediate feedback about how we're doing and repeat. Did that happen in your graduate school or in your supervision?
Yeah, no, you're bringing back some memories. Oh, it felt like it was so long ago. But even when I am training, therapists and interns, absolutely, I see that there are times when it's like, I wish there was some way to make this process a little more helpful for them, a little
Yes,
better,
yes,
right?
yes, yes.
Because it makes me think. So when I was a student, that's right, I would get permission from the client. Hey, do you mind if I record our session? It's just for my learning. I
Yeah.
won't mention your name or anything like that. And but yeah, so I sometimes got evaluated on maybe a 15-minute clip.
When you're
you know
seeing 20, 30, 40
that's right.
clients a week and your
That's
supervisor
right.
may have watched 10 or 15 minutes. And that's
That's
the
true.
same as educators, right? The professors have how many students in their classes? They can't watch hours and hours of videotape.
No.
Yes, they have rubrics. They're watching a clip. They're trying to get a sense of how that student is doing. But imagine if we gave that rubric to AI and said, can you evaluate all the sessions? And on the metrics that we know are connected to client outcomes, how much is the client talking versus the therapist talking? How is the level of empathy? What is the alliance like? How are they doing in terms of open ended versus closed questions, right? Their listening skills, their reflecting skills.
Mm,
Are they building hope and optimism? Are they collaborating, right?
mhm.
We know the common core skills that are consistent across many models of psychotherapy. There are basic core counseling skills we can all agree on. Let's see if therapists are using those skills. How are
Yeah.
they doing? And then imagine a dashboard that says, "Oh, your supervisee is talking 90% of the session. What's that
Yeah,
about?"
yeah,
Or
yeah, yeah,
this
yeah.
supervisee is asking 90% closed session, closed
questions.
questions versus open-ended
Yeah.
questions. Um, this client, and you can also collect client feedback, client outcome measures as you're gathering data about the therapist intervention. So, what's the client's perception of alliance? We know that matters more than our perception of the alliance.
Yeah.
How
Yeah.
are they reporting their improvement and progress on their goals? And how does that connect to what the therapist is doing in the session? So we can see and track how clients are doing, how therapists are doing on specific skills, and be a better supervisor
Yeah.
for
Yeah.
our students. Because
Absolutely.
it's so hard when we don't have time to go through every psychotherapy hour and code it on a particular rubric. It's too labor intensive. We can't scale that, but AI can scale that. So why would we not take advantage of that to get more information about how our students are doing, how we're doing as providers, right?
Yeah.
I mean, the
Yeah.
research is not great. We don't tend to get better with time. We don't just get better because we've been practicing longer. We get better because we practice in a very specific way
In a deliberate
and
way. Yeah.
in a deliberate practice
Yeah.
way.
Yeah.
Exactly.
Yeah.
Exactly. So we haven't, I think, had the ability, the tools to do that before, and now we do. So I'm very
Mm.
curious how education will change, how supervision will change when we have better tools, because I
Yeah.
think, and I'm curious your thoughts,
Sure.
that if we think of psychotherapy as skill based, there are certain core skills we need to learn. Would you agree with that?
Absolutely. Right.
Yes.
Like yeah, that good reflective listening, active listening, the
Right.
empathy, the ability to empathize,
Goal
and
setting, being able to provide psychoeducation and clearly articulate what we're doing. And I mean, sorry, I
they are.
interrupted,
Yeah.
but yes,
No, no.
so many different skills. And yet, how do most clinicians learn? They read a book and then they go see a client and are supposed to implement what is in the book.
Yeah.
We don't ask ballet dancers or basketball players or artists or anybody else learning a skill to go read a book and then go execute, right? Now it's
Yeah.
game day. You just read a book about how to do pirouettes, go do it, and nobody's
Yeah.
going to give you feedback. And then you come back and talk to the coach a week later and say, maybe it's basketball, I wasn't able to make any of my shots. I don't know why. And the coach is not watching the videotapes or is not there to see what's happening. I feel like there's a parallel with psychotherapy
Mm.
that we need more observation of what's happening and more practice of those skills and immediate feedback. So I think the potential for AI to really improve education and skill building is there. And deliberate
Yeah.
practice we know works, but it's so labor intensive. This is where we, break down parts of a skill into very small pieces and practice them over and over with feedback. Most supervisors aren't doing that in their psychotherapy sessions. That's
Right.
a lot. We're mostly just talking about how we think things went, how we feel about a session, our countertransference. But we could use these tools to develop some really amazing, I think, teaching and learning tools.
Yeah. Oh, absolutely. I definitely, again, for the development, and it definitely would make it easier, and for these instructors, for these supervisors. So yeah, I do have a couple of thoughts
Good.
on this in
I
the
want to hear
context of the therapy. Yeah, I guess
it.
so. One thing was, so just about a week ago, I was having a session, and we were talking about some stuff, and I remember, I felt, oh, this might be a good time just to share some of my personal experiences that I think could
Yeah.
help. And one of the thoughts I was having around that was that, in those moments,
Yeah.
I felt I was being really authentic,
Yeah.
and in some of the sessions where I feel like I'm really connecting well with the client, I do think it's this authenticity that comes out.
Yes.
And one of the thoughts I was having is that, if I am relying on AI to tell me what I should be saying, to tell me which direction I should be going, because that,
Mhm.
statistically can be more effective, produce a more
Mhm.
effective outcome. I think
Mhm.
it can come at the price of the therapist being less authentic and less
Mm.
genuine. And right. And then we know, like, back from grad school, Carl Rogers, one of the waves of psychotherapy was this sort of
Mm.
humanistic approach, right? Like,
Yes.
we don't have
Yes.
to be so manualized at times. We just got to be able to connect, show this positive regard, empathic, non-judgmental, be
Yes.
warm.
Yes. Yes.
And I think if we rely too much on these external tools to tell us where to go, we're at risk of losing some of that and compromising it. Yes, that's sort of
I
one of my thoughts.
I love that thought. Thank you for sharing it with
Yeah,
me. It brings up a lot for me. I agree, right? We want to maintain that human connection. We know that's what is
exactly.
the magic, that attachment, that
Yeah,
love, that
attachment.
um that in the moment they're feeling us and feeling our care and concern for them. Absolutely. It makes me think of dance when we have it's one of my hobbies.
Sure.
You take a dance
Yeah.
lesson and your brain is like, oh my God, left, right, what's happening? This is so hard. Practice, practice. And then you have a competition day. Competition day is not the time to be like, what am I doing? Should I do this? Should I
Right.
do that? Being formulaic. It is letting go and
Mm,
allowing yourself to be in the moment and trust what you have learned. So I think you're right. There's a time and a place for the systematic practice
mhm.
and deliberate practice and feedback and analysis of what we're doing. And then there's game day where we have to allow ourselves to get a little bit out of our head and in the heart, right? In the
Yeah,
moment of feeling the connection. But I
yeah.
think both are possible. I think our human connection can be enhanced if we also are looking at other data. So let's say, for example, you self-disclosed, you
Mhm,
perceived your client to feel happy and grateful and more
mhm.
connected to you as a result. But then you look back and ambient AI has been listening to the session and you find out she actually, there was an emotion analysis and she was also feeling some irritation and some
Mm,
surprise that she didn't share with you.
mm.
That's curious. So
Right.
maybe there's an opportunity to come back and have a conversation about, I wonder how that was, my self disclosure. You shared that you liked that I shared something personal about myself. I wonder if there was anything else. What was that like? Sometimes when
Mm.
we self disclose, it can feel a little surprising, or maybe there was a little bit of irritation at me.
Yeah,
I don't know, right? It
yeah,
gives
yeah,
you,
yeah,
it opens up the possibility of gathering more information than we were maybe picking up in that moment.
yeah, yeah, it's a good point. Again, yeah, and I could see that definitely being the case, especially, because it makes me think how, um, so much of psychotherapy is, like, very much like an art form,
Yeah,
right?
we're
It's
doing
like,
our
we're
best.
doing our best,
We're
right? But
following
that
the lead of our
they're
clients. Yeah.
that's right. That's right. And I was just thinking how earlier in my career I definitely did a lot of talking. I remember, like, at one point I had, like, this little whiteboard in my session because I felt I had so much knowledge that I was learning in
You want to
school.
share
I
it?
want to share it, because I
Yes.
think it'll help you. And
Yes.
it was a supervisor who reviewed my tape, thankfully, and she says, "You're doing a lot of teaching, a lot of talking." And
Right. So imagine if the
yeah,
supervisor can see across all of your clients this theme of, wow, you're talking more than the client is most of the
yeah,
session. You're providing a
yeah.
lot of psychoeducation. Let's create some pauses. Let's allow them to come
And
forward. And
process.
imagine if we can benchmark how therapists are doing in relation to what we know contributes to good outcome. Let's say we know in emotion focused couples therapy, for example, is a model that I practice from, and some of the data suggests the more enactments that can happen during the session, the better the outcome. We want
Mm,
clients to have a corrective emotional experience with each other in the moment, right? We want them to share their deeper feelings with each other. So if we know that, and I can track what's happening over time, and I see, oh gosh, I'm only doing one enactment a session or every other session, that's a problem.
right.
I need to up that and prioritize that. It's I think about AI as like an extra set of eyes
Mm,
that can give us data that we may be missing and that we can share with supervisors, right? And say, what am I missing or what are my patterns?
yeah. Oh,
Yeah.
it's great points. Great points. Milena, I want to thank you. This was excellent. You really, increased my knowledge and increased my excitement about this.
Oh,
I'm
good.
much less apprehensive, and I'm going to share this with a lot of a lot of people that I know, and because we've recorded this video, we get to share it with so many more.
Yay.
So thank you for doing this. I really appreciate it. It was so good to see you. And for all you viewers out there, thank you for tuning in. Feel free to please hit the subscribe button. And if you're interested in more conversations, check out this YouTube channel. And I'd love to hear your comments about some ideas for future episodes. Once again, everyone, thank you. My name is Richard, and thank you, Milena from California. And hope everyone does well with all of this knowledge and keep having a balanced life. Take care.